Have a look at this clinical question. So the split of answers is really interesting. It's almost equally split between D, E, and F. So confirm a diagnosis of asthma and either offer PRN air therapy or for a low-dose MART regime or for low-dose steroid plus PRN salbutamol. That's what a SABA is, right? So these three almost equal. Then a few people said confirm a diagnosis of asthma and just give salbutamol PRN. What's interesting is hardly anyone has picked A and B, which is good. It shows that you've already learned that part of the guideline, i.e. what's the diagnostic threshold for an adult. You can see if their FeNO levels are 55, that's enough to make a diagnosis. Because what's the threshold? Type into the chat. We covered this in the first question. Just let's consolidate it. 50, that's right. The new threshold is 50. It was 40 in the old guideline. For adults, it's now 50. Okay, so the correct answer is D. We've got enough to make a diagnosis, so that's the first part. So we can eliminate these two. Well done. So we confirm a diagnosis. And then the first step is to offer PRN air therapy. Okay, so let's do the next question, and then I'll go through this guideline, and we'll go through what is. Actually, let's go through the guideline first. So you've got someone, in this case, newly diagnosed. Remember, the threshold 12 plus is now the same as the adult guideline. There's just one for everyone 12 plus. So children 12 and above and adults all have this guideline. So the first step, once you've diagnosed, is to go on to PRN air therapy. What is air therapy? It's basically, it stands for anti-inflammatory reliever therapy. The anti-inflammatory is the steroid. Okay. So PRN air therapy has the same exact components in the inhaler as MART, i.e. it's got budesonide and formoterol. That's for children. For adults, you've got other options, okay? You know, formoterol is still the LABA. You've got other options for the steroid, okay? The difference is, remember with MART is maintenance and reliever therapy. You only have the one inhaler, but you take it regularly every day, and then you take extra puffs if you get short of breath. In PRN air therapy, you don't take anything every day. You only take it when you're short of breath. So instead of having as the first step, which was in the old guidelines for adults, having a salbutamol inhaler, a blue inhaler, which you just take when you get short of breath, and then only if you're having to use that a lot, you'd move on to steroid. As soon as you diagnose someone 12 plus with adult, you want to go straight on to having some kind of steroid. But they're only using it when they need it. And that's because of the anti-inflammatory impact, and the evidence is now overwhelming that this is so much more effective instead of having salbutamol, which does nothing. It gives you that short-term relief, but it isn't helping at all in terms of the long term. So PRN air therapy is an inhaler with a steroid and formoterol. Okay. So at this stage, it's a low dose, and they just take it when they need to, whenever they're short of breath, whenever they're a bit wheezy, or if they're having lots of nighttime cough, they just take the inhaler. If then it's not well controlled, they'd go on to a low dose MART. Basically, it's the same inhaler, but now they take it every day, regularly. And if they get short of breath, they take a few extra puffs of the same thing. So what's in MART and what's in air is the same thing. The difference is air is a PRN option. MART you take regularly, and then also PRN, just extra dose of the same thing if you get short of breath. In all of these options, do you see there is no salbutamol anymore? There's no SABA. It's removed in the new guideline for adults completely. Okay, because anyone on MART doesn't need a separate salbutamol inhaler. You just take a few doses of the extra dose of the same thing, because the LABA, formoterol, is a fast-acting LABA, okay, long-acting beta agonist. Okay, now if someone at diagnosis is really highly symptomatic, or they've had lots of really severe exacerbations, then you'd skip the PRN air therapy and go straight to having a regular MART regime. So straight on to having take inhaler every day, morning and evening, and if you get short of breath, take extra doses of the same one. Not well controlled, the next step is moderate dose MART. So essentially, again, same combination, but the steroid dose doubles. Still not well controlled? At this stage, again, this is a big change in the new guidelines, because what you do now is check FeNO again and check their eosinophil count. If either's raised, refer them to an asthma specialist. If neither's raised, then you could trial either putting them on montelukast, so a leukotriene, or a LAMA, long-acting antimuscarinic, okay, alongside continuing the moderate dose MART. Still not controlled on that, refer them to an asthma specialist. So this is the guideline for adults. Hope you found that helpful. Please do subscribe to the channel, like and share with your colleagues if you'd like more content.